Good afternoon, ladies and gentlemen, boys and girls. Once again, it's your boy Jay Stein coming at you with a little bit of a mid-afternoon lunches for wimps type update. Guys, we're talking about PRQR. It's ProQR Therapeutics. Now, these guys just announced that they have reached a phase 1 to phase 2 trial for it's a treatment that they're using for it's a condition called retinitis pigmentosa, and it also will work on Usher's syndrome. Essentially, these are genetic mutations that are inherent. So one of them just makes you slowly go blind, and that would be the retinitis pigmentosa. I don't know how to say that. And then Usher's disease actually causes blindness and deafness. This is a clinical stage company, and what ends up happening is they generally will get marketed out to other big pharma companies. So say the big pharma company has, a piece of the therapy, and this is the key that they have that PRQR has, then they'll market and license it out. Problem is, if there's any bad news, this thing will tank so quickly. It is, I've gotten caught in these before. Now, the issue here, besides the risk of that happening, because just because it cleared one stage does not mean it's necessarily going to go to market or even be commercialized in any way, shape, or form. Now, if you notice today, there was a major spike, obviously, like 47% up, roughly. But the issue is the average volume. The average volume is not very high. It's like 700,000. $1,000 a day, which is relatively low. So if this thing does dump off, you could get stuck holding the bag when the volume's that low, and especially when it's this big of a spike. That could just mean somebody's running it up, a big shareholder, what have you, and then they could dump it off. And you know what? Hey, it might hold, somewhere between 7 and 8 for a while. But again, any bad news whatsoever, it's going to tank. And because of that low volume, again, you're running a pretty big risk with that. Is it a pump and dump? I don't know. These diseases or RNA mutations that they're trying to go after, obviously, no one's been successful at it yet. So it would be a breakthrough entirely, but that in and of itself also poses another risk. Like, this has never been done before, and I'm sorry, this is a pretty small, actually a very small company out of the Netherlands, and like I said, be careful. If it were me and I happen to be in the know, about it, somebody told me about it or whatever, and this happened, I would be selling big time. I'd probably hold a little bit, but for the most part, I would definitely look at selling this thing. But again, I would keep some of it just in case it does continue to go up, or the company gets bought out, or there's a partnership, joint venture with one of the big pharmaceutical companies. But anyways, with that said, guys, PRQR, buyer beware. You may want to take your profits. Anyways, I will check back in with you if any other news comes up. Otherwise, y'all, happy trading.